Hi, everyone. Today, I'd like to introduce our guest speaker, Dr. Meredith Gartin. She is an assistant professor of global health in the Department of Health Policy and Organization at the School of Public Health. And tonight, she'll be discussing inequity as it relates to the impact climate change has had on both maternal and newborn health. And I'm sure we're all very interested in what you have to say, so I'll let you take it from here.
Well, thank you so much for inviting me to speak today. Just a little bit more on my background. I really began looking at climate change and water scarcity when I was doing my doctoral work at Arizona State University. And at that time, I was working alongside with decision makers around water policies, and then doing some cross-cultural research through something called the Global Ethnohydrology Study, which was looking at cross-cultural knowledge and beliefs and perception around climate change and the impact that climate change was having on its health. That's a project that's led by a cultural anthropologist and medical anthropologist, Doctors Alexander Brewis and Amber Wooditch, who are both out at Arizona State. Then I've continued to build on that research a little bit, and here have found myself working in collaboration with so many wonderful maternal child health experts in public health. That's not really my area of expertise. My area of expertise is looking at biocultural models and anthropological models of climate change and climate change impacts on health. So this is a fun talk for me because it's one that allows me to bring some of that perspective to maternal and child health, and hopefully inspire some of you to think a little bit about how environment and culture can play a role in creating health outcomes for MCH. Okay, so we should all be seeing my title slide. To get us started, this is a slide that the CDC has made, and you can see it's animated. It's very fun. It's sort of highlighting the ways that we think about climate change on health. In the center, there are rising sea levels, there's more extreme weather, there's rising temperatures, and then that's having an effect in some of these external environmental areas, such as air pollution, severe weather, changes in vector ecology, which then branches out even further to talk about different kinds of health outcomes. Now, I'm going to go ahead and stop the slide from moving so I don't accidentally hypnotize any of you. But the point here is that climate change impacts a wide range of health outcomes. And it also looks at how these create different types of exposures. And each of these exposures play out very differently on the human body and for different households. And when we think about this from a perspective of public health, we often call these kinds of exposure risks involuntary exposures. That's a term that Jonathan Patz, P-A-T-Z, sort of very much coined and has done quite a lot of research on. And that means that it's an exposure that's a little bit out of our ability to eradicate ourselves. You know, we can spend time with that exposure to try and mitigate and adapt to temperature changes or to different kinds of vector ecologies that are emerging and popping up. But to really stop some of the impacts of climate change or slow the process of climate change as an exposure risk, that takes something of infrastructural and systemic changes. Now, one area that's very rich is maternal health and exposure to heat. There's quite a lot that's been written and published on temperature risk and maternal health. This article here that was published in 2022 really highlights that there is evidence that temperature extremes adversely impact birth outcomes, including but not limited to changes in length of gestation, birth weight, stillbirth, and neonatal stress in unusually hot temperature exposures. And I believe actually it might be 2017. That's what, that was the publication date. This study includes a review that indicates that there's not only some research that's been going on, but there's a great deal more research that needs to be done, including finding standards for assessing the effects of heat on maternal fetal health. There's even more that's been written about the connection to, child health and other vulnerable groups in this population, with much of the dialogue and the discourse being around the idea that, some of these are already vulnerable people living in even more vulnerable places that are experiencing climate change in even more extreme situations. And we see that in global health. And that becomes the issue of health equity that we are tasked with, is to think about how we can find a way to mitigate some of these stressors and do so that those who are most vulnerable and those who are most at risk are often dealing with other confounding factors. And I think most all articles that I've read in this area of maternal child health and climate change can be best summed up with these three main points. It's happening to people. Women and children in lower income countries and resource scarce environments are most vulnerable because climate change seems to be happening there more frequently and the impacts are more severe. And finally, that future steps really need to identify those at risk locations to provide more direct services and try to think and identify mitigating and coping strategies. Moreover, this is all being done at a global scale for a global call to action, because we recognize that climate change might be happening across the board, but it's an interconnected system. So where some people might be releasing an abnormally high number of greenhouse gases, that's going to have effect in the atmosphere that's going to have an impact maybe in a location that's quite distant from where the source is. And what I'm going to argue here is that we need a more holistic and integrated research question to really address how people's ecologies and their quote biologies are changing, because our bodies are adapting and responding to climate change. And it's our challenge in science and research and practice to be able to sort of archive that and note it, observe it in ways that can fully incorporate the social, the cultural, the biophysical. And when we look here, we look at all this climate change research that's been done. And this is climate change, original, non-original research from mostly ecological sustainability science and other areas. And you can just see it is just peaking up over the last, couple of decades. We've seen a rise of interest in this work, up to a number of 800 publications. The Lancet reports just almost annually on the state of research and climate change, and this is from one of the 2021 article. But when we look at maternal and child health and the climate change research, we see that it's up, it's down, it's up, it's down, and it's much smaller in quantity versus, up to here, our y-axis goes up to 40 versus here looking at environmental science, it's going up to 800. So what I'm offering is that we've got these two really strong, very siloed areas of research that are doing amazing things, and more integration of those qualities is needed to help kind of leverage our understanding around maternal and child health. And one path forward that I'd like to offer here is one that has always been a lens that I've used in my research to ensure that I'm really thinking not in necessarily exclusive categories, but rather in integrated ones. And that is the lens of embodiment. Embodiment begins from the notion that the body is not the object to be studied in relation to culture, but it is considered to be the subject of culture. That our bodies can show our cultural values, and that we somehow embody our environments. It really is something that comes from anthropology. There are other fields that have used it, but anthropology has really taken the notion of embodiment and developed it through a number of different studies looking at inequity in particular, and also health outcomes. And I also use biocultural frameworks, which makes me constantly think about that nexus, that point, an area where culture, people's health and biology, and their environment all converge together on an issue. And climate change and health, particularly for maternal child health, is a really great opportunity to explore that nexus. Theories of embodiment upend this dualism between the mind and the body. When we talk about the mind and the body, we usually talk about them as two different entities. This dichotomy has influenced biomedicine, psychology, and psychiatry, and many other disciplines that separate the mind from the body. If you ask a doctor how you feel, it will most certainly be probably some kind of body part. Do your joints hurt? Is it your stomach? On the other hand, if a psychologist asks you how you feel, that's said to be slightly more subjective. It will reference your emotions and your mental health. Are you sad? How are you coping with life circumstances? The mind-body dualism is said to have come from René Descartes, and that is called Cartesian dualism. But there's a difference between how the mind and the body have been theorized versus how they're enacted every day. We intuitively know them to be linked together, but when we practically deal with them in research and science, we tend to exclude them. So another piece of embodiment is thinking about our bodies as a way that we are interacting with this world. So when we put environment, culture, and biology together, a really common example is one of such as this, a man, very professional looking, walking down the street. In society, we often think of how to walk and how to present yourself. So we see this man, he's walking straight up with his chest out. An embodiment lens might suggest that he's walking this way because his cultural norms from his external environment suggest that he should. He should present himself as strong and confident, and by standing straight with his shoulders back and his eyes forward, he's making his way through his environment. His body is responding and embodying the cultural norms, shaping the way that he interacts with the world around him. Those of us on the other end of the spectrum that also look at sociocultural impacts and we really think about health outcomes, what we have are anthropological colleagues of mine, such as Clarence Gravely, Alan Goodman, and Nancy Krager, who focus on racial health and inequalities and how those become embodied and literally incorporate biologically the material and social world in which we live from conception to death. Meaning that embodiment is something that happens over the life course. By studying human health through a life course lens with embodiment, we can really answer some questions such as, why do infants born in African-American women experience lower birth rate at such higher rates than those born to US white women? This is the first kind of example that I want to give. Research has shown that first generation African-born Black women actually have infants whose birth weights are matched to those that are American-born white women. So foreign-born Black women who come to America and give birth will have similar maternal fetal health to those of our white women research. After the first generation, the next generation of children and infant birth weights are going to match those of African-American women here in the United States. And what this means is that after one generation, infants born to foreign Black women end up having higher rates of low birth rate. So clearly, this isn't about genetics. It's about something that's happening within the social and economic environment that's changing the biology of women and placing African-American women at a higher risk. Is it stress? Is it discrimination? Or is it some other process that we haven't fully understood? Research is still figuring that out. But for these scholars, embodiment is how we biologically integrate the stress and exposures that are being experienced through our environment. It's how we interact with our environment. Each of these scholars also approach embodiment from biocultural perspectives, looking at that sociocultural, biological, and environmental context that overlaps. And it's worth noting here that Our definition of health from the World Health Organization is one that is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So health is defined and should be examined with more holistic approaches and informed by all social, environmental, physical, and well-being. I want to look again at another example, some compelling research from the role that temperature plays in establishing birth rate. And as an environmental stressor on the body's ability to function, particularly when women are pregnant, this can exacerbate sort of biological outcomes. There's evidence that temperature extremes adversely impact birth outcomes, including but are not limited to changes in the length of gestation, birth weight, stillbirth, neonatal stress. And this table here is showing the articles through the literature review of what their outcomes were. And the majority of them are showing significant effect in preterm birth. Of the outcomes, that's the one that's most common. Low birth weight at the time of delivery relative to gestation age was also examined by 5 other studies, and it's pretty common as well. The literature has not established a critical period of maternal sensitivity to these hot temperatures, which is one task that needs to be examined. And at the time of the review, no preterm birth or birth weight susceptibility window period had been established. But you can see that each of these articles does talk about the exposure window of when they were experiencing during their terms the extreme temperatures. And due to the variability in measured exposure windows, there's no consensus in a critical window period. Of the studies that measured full-length gestation, each trimester was separately identified as the primary window. There is limited evidence for critical heat-related window protocols, but there's no real standard that we've been able to find. And for me, tracking this growth through the life course will also help us understand some of the long-term effects that some of these acute exposures may have occurred. Which brings me to my last one. This is kind of a really compelling article that was just recently published in Anthropology around water scarcity, thirst in the fetal environment. The study aimed to compare the perceptions of thirst. When do you feel thirsty? How do you feel thirsty? In 2 very extreme thermal environments, in Kenya and in the lowland of Bolivia. They examined how the environment, physiological and culturally specific factors were assessed with current thirst and perceived pleasantness of drinking water. So that moment when thirst is quenched. They found that the thirst ratings, particularly the perceived drinking water, were higher among the hot, humid Amazonian environment than among the hot, arid environment. So people's perceived quenching of their thirst was higher in the hot and humid than in the hot and dry. In contrast to their hypothesis of increasing thirst with greater temperature, so that the hypothesis that they get thirstier as it gets hotter, the study found that actual physiological measurements of hydration, so taking people's blood when they felt like they were thirsty, was not a reliable predictor. That the thirst was more perceived, it was more experienced sort of mentally than it was physically. And they did find what I think to be even more interesting, that the season of birth seemed to moderate an association between the ambient temperature and thirst, meaning that there was a significant interaction between the season of birth for people and their experience of thirst over their life course. So people who were born in the wet season, in utero during less water availability, reported a positive but blunted perceived pleasantness of water. So they were quenched, their thirst was quenched when rising temperatures. But that was not seen for those who were born in utero when there was greater water availability. Their findings of a blunted thirst response to a situation of different kind of water needs in the environment due to temperature is actually similar to what we see in animal models. Animal studies have demonstrated that maternal dehydration in rat dams affected the development of thirst response to their offspring, such that those exposed in utero to dehydration did not exhibit higher thirst responses in response to their own hydration. That there might be some kind of adaptive mechanism taking place in utero to help that then plays out over the life course. And the study also looked at people who were of different ages and looked at different times and found that with age, these experiences held true. So the primary point is that our environments and our climates are not equal to each other, just in the same way that we know our social and economic environments are not equal to each other. How we embody that experience of climate change is so unknown in research in areas of science. And what that thirst kind of article shows is that it's not experienced even within the same household or within even the maternal and fetal connection. So research in maternal child health has been really excellent at identifying the social and economic stressors that impact biological outcomes. And I think the new challenge now is to really lean in and look at some of the tools and resources that environmental social scientists have established and find ways to integrate that a little bit more, and really thinking not about some of the dualism aspect to the way that we define health. In many ways, didn't medicine and health professions arise to address the question of how can we attend to human suffering? And when we think of human suffering in a subjective state, and yet the objects that are causing our suffering are in these objective physical states, we miss out on being able to understand the whole story. Sometimes when we look things objectively, they allow us to look at objects that are physical and think about them critically, but we don't fully understand how they create that sense of suffering. Embodiment as a lens lets us look through and think about the body as an integrated piece. So with all of that in mind, we need to remember that the central principle to embodiment literature is that we're not composed of separate minds and bodies. We're holistic individuals. We can't buy into the categories too much. They're great for scientific analysis, but they're not useful for people who are trying to make a life worth living and trying to cope with environmental stresses that are involuntary exposures. Instead of compartmentalizing ourselves into these separate entities, and instead of siloing our research between what is environment and what is maternal child health, we really need to think about how to integrate these. And I'm sure all of you have seen this metaphor before of transformative research, that there's multidisciplinary research, this type of fruit plate where every discipline comes together, but they don't really change their form. They ask their question from their disciplinary perspective, and then we discuss the different answers. And then there's interdisciplinary research, which is a little bit like a fruit salad, where you come together and you kind of mix everything up and form a new plate of food, and you're trying to ask questions in fields and come up with new approaches. I think the research that we've seen on temperature and the maternal biological outcomes is a really good example of the fruit salad. But I think by applying an embodiment lens and really thinking about ways to examine some of the life course, or by proxy model and estimate what impacts people might have, we've got to transform that research. We've got to call in maybe a few other fields, such as anthropology or other kinds of social sciences, that are really thinking about how to operationalize that cultural environmental component. Embodiment is just one lens that we can draw upon. It's the one that I chose to speak about today. because I really do like the way that it incorporates the idea that we, our bodies, are interacting with our environments, and that should be the point of object of research and unit. And it also strives to look at the ways that those things all intersect out of people's culture, their environmental state, and then their health and biological outcomes. I shared a lot of different references today, and I wanted to provide those on a slide in case anybody wanted to look some of this research up. The article about the thirst and fetal environment that was published in 2021 is by Rosinger. And thank you all so very much for the invitation to speak today. I'm going to end the show and just open this up for conversation and questions. My question is like, okay, how do you do it? And I think that the part 2 to this, once you can fully understand how to integrate the embodiment lens, or how to think of the environment as something that can be interacted with, then that's when you start having methodological discussion. That's when you start to really reach out and do a little bit of investigation to come up with new ways of thinking about your survey collection or your variables of measurement. And if anybody's ever interested in talking more about that, there's some really fantastic, again, anthropologists that have been doing work and thinking about how to operationalize cultural knowledge, cultural and environmental knowledge, and have a wide array of methodological tools to do that. I see Lillian wrote, I think that was my question. I'm really interested in this work at the intersection of maternal child health and climate change, but I don't know how to engage. And so I think that that's one tool. I'll say that there are ethno-hydrological, the global ethno-hydrology study is built off of an entire toolkit that's used in environmental anthropology to look at that integration. So it would be a fun thing to look at. One way to engage is they have different kind of methodological trainings available at conferences. And so there's a way to continue your education, get continuing education credits at those conferences, and maybe pick up a new methodological skill and network with some of those conference people in those areas. The Society for Applied Anthropology, for example, is a really good conference and way to engage and learn more about some of this. I see in the chat, thank you for the great presentation. Thank you so much for that compliment. What are some future research directions that could build upon the findings of these studies? Well, I found the whole thirst thing to be fascinating. And I had not really thought about all the ways to quench one's thirst. And although that seems relatively simple, I think you can see that this study really took something simple and was able to dig deep into the root causes of that biological response. So I think one way that you could build upon this is to think about what's a really simple thing that happens when you're experiencing heat stress. Like we have all those biological outcomes, but I think coming back and thinking about what's the root cause of that? And when I experience that, how do I respond? That study had a whole bunch of ways that people respond to stress, to thirst, and such as eating a piece of fruit, right? If you don't have any water available or water's not quenching your thirst, you could have a piece of fruit. And all of that might sound a bit silly or low-hanging fruit for a poor pun, but the fact of the matter is that that's one way to really begin to unwrap the interaction that people are having with their biological responses. Another area that I think is an interesting and fruitful area of research is we have so many people right now in indigenous communities, even in the United States and Alaska and in Hawaii, that are being displaced because of climate change. And that's causing them to move into different environments and have to adapt their strategies of subsistence or hunting, or even the way that their houses are constructed sometimes. And those can have feelings and sentiments of suffering that we don't fully understand. And when we think about maternal child health, that can also disrupt certain patterns that women experience through their processes that might be more traditional in one location and then uprooted from that, having other kinds of stress. So I think Alaska and other areas where you're seeing climate change dramatically affect the environments that people are use and interact with is another area that we should be looking at. I think in the state of Alabama, another example would be how often do we look at this, think about what was going on in terms of environmental seasons when women are giving birth. We know that low birth rate is a big issue here, but have we really considered, those times when it's hurricane season and what impact that's having on women during their pregnancy? I think that other example of the systematic review of heat stress on maternal fetal outcomes also sort of indicates that the seasons in which these processes are happening are becoming much larger influencers on our health outcomes. And perhaps that just needs to be something that we start to really consider as a given rather than something that's to be investigated. That's another example of something that could be added to a survey tool. There is, I see, I was going to ask if there is any climate related study in Alabama, and thank you for mentioning that. There are climate related studies in Alabama. There's actually a lot of climate related studies going on in the US, but I will say that some people aren't necessarily putting a climate change label on them. So it's sort of like looking at those environmental scientists that are doing a lot of practice-based and applied research. I won't give an example of Alabama, but I will give an example in the Midwest. Right now, there's a lot of new technologies going in because the Midwest is dealing with major droughts, and that's dealing with a lot of erosion. And so we're seeing kind of a preemptive dust bowl effect, which is very concerning. And instead of going in and doing climate change interventions with the farmers, people are going in and doing erosion interventions. And erosion is something that they know is the problem. So it's actually improving and creating more sustainable practices in these areas without labeling it as such in those communities. So one thing I think to look at when you're looking at people who are doing research in Alabama is to think, are they doing applied practice that's actually helping to mitigate against some of these weather challenges that we're having, and just not calling it climate change? And I think you might find that there's a lot of really interesting environmental applied work going on in the state around water supply, around water security, that also has perhaps a climate change component to it.
Yeah, I just asked a question, but I think you kind of answered it. Sort of like how, I think sometimes we think about climate change as being at like we have a little distance from it in the US, and that it impacts, all these other countries. But kind of like you said, that's absolutely not true. But
Yeah.
like, how do we get people to think that it's more important? But I guess what you said is like shows how important it is to go in and kind of like conduct a needs assessment, get buy-in from people. And maybe what you're calling it isn't what they're calling it, but you're still addressing like the same root issue.
That's right. I think so. The World Bank did a really interesting survey, global survey, maybe like 5 or 6 years ago, looking at climate change perception to see, how many people were still resisting climate change as a given fact. And really, the US is the only one lagging in that. Globally, we see people accepting climate change as happening, that it's here. But there's resistance to that science for whatever reason in the United States. So I think to be effective, interventionists or effective policymakers or effective in our applied work, we have to really, engage those communities and think about what's the problem that we're all dealing with and how can we respond to it in a way that fits that group. And again, it comes back to that original question of embodiment. How are you interacting with your environment? And what does that look like? And how is that affecting your health?
Yeah, that's interesting, but I'll have to look that up. The US is it's unfortunately, we're all going to be confronted with it or are being confronted with it. Like storms are worse, there's more flooding, all of these environmental sort of, yeah.
And I mean, some of the more recent hurricanes, like the sandbars are gone, right? the sea level has shifted where some of our coastline is. And that's real.